Imagine a bright Saturday morning. The grass is freshly cut, the air is crisp, and the sounds of parents cheering fill the air. On the field, a group of teenage athletes is sprinting, weaving, and chasing a soccer ball with the kind of intensity that only young competitors possess. It is a scene played out in thousands of towns across the world every weekend. But hidden within this picture of health and vitality is a silent, snapping statistic that medical researchers have been trying to solve for decades. In the blink of an eye, less than the time it takes to snap your fingers, a player plants her foot to change direction. She doesn't get hit. No one tackles her. But suddenly, she collapses. The crowd goes silent. It's a sound and a sight that coaches and sports medicine doctors dread more than almost anything else. It is the moment an anterior cruciate ligament, or ACL, gives way. For years, we have known that this injury is not just bad luck. It is a biomechanical puzzle. And more importantly, it is a puzzle that disproportionately affects young women. In fact, adolescent female athletes are significantly more likely, sometimes up to 10 times more likely, to suffer this devastating knee injury compared to their male counterparts in similar sports. It is an epidemic that has sidelined dreams, ended scholarships, and led to a lifetime of knee problems for millions of young women. But what if the solution to this problem wasn't just about doing more squats or running more laps? What if the secret to saving these knees lay in the way the brain talks to the body? What if we could rewire an athlete's movement patterns in real time, using advanced technology to show them exactly what their skeleton is doing while they move? Today, we are going deep into a fascinating piece of clinical research that aims to answer exactly that question. We are going to explore a landmark study that took high-tech laboratory science and applied it to the soccer field. This is the story of how researchers attempted to use biofeedback, a live, digital mirror of the body, to teach young female athletes how to move differently, how to land safely, and ultimately, how to protect their futures. To truly understand why this clinical trial is so important, we first have to understand the anatomy of the crime scene, the human knee. The knee is a hinge joint designed mostly to bend forward and backward. It is held together by 4 main ligaments, which are like strong ropes that connect your thigh bone to your shin bone. The ACL, or anterior cruciate ligament, is the crucial rope in the middle. It stops the shin bone from sliding too far forward and provides stability when you twist or turn. Now, here's the problem. The knee is caught in the middle of a kinetic chain. It is stuck between the hip and the foot. When an athlete plants their foot on the ground to cut or change direction, the ground pushes back with immense force. If the hip muscles, the glutes, and the hamstrings don't control the leg properly, the knee can collapse inward. Picture this. You jump off a box and land. If your knees bow outward, like a cowboy, your ACL is generally safe. But if your knees knock together, collapsing inward toward each other, you enter what scientists call the valgus position. This inward collapse puts extreme tension on the ACL. It is like bending a glow stick. Eventually, if you bend it too far, it snaps. For reasons involving anatomy, hormones, and neuromuscular control, young women often land in this valgus position more naturally than young men. Their knees tend to cave in when they land from a jump or when they cut to the side. This specific movement pattern, the knee abduction moment, is the villain of our story. It is the #1 predictor of a future non-contact ACL tear. So, the medical community asked, if we know how the injury happens, why can't we stop it? We have tried. For years, coaches have used neuromuscular training drills that involve jumping, balancing, and strengthening. And they work, to an extent. But they don't always stick. In the heat of a game, when a player is tired and chasing a ball, their brain reverts to old habits, and the knee collapses inward again. This is where the clinical trial we are discussing today comes in. The researchers behind this study suspected that standard training wasn't enough because the athletes couldn't see what they were doing wrong. You can tell a player, don't let your knees cave in, but in the split second of a landing, they can't always feel it happening. They needed a way to close the loop between the brain and the body. They needed biofeedback. This brings us to the specific clinical trial we are analyzing. This study was a rigorous, randomized controlled trial designed to test a high-tech intervention in adolescent female soccer players. The researchers weren't just looking for a new exercise, they were looking for a better way to teach movement. The study took place in a sophisticated biomechanics laboratory, but its heart was on the soccer pitch. The researchers recruited a large group of young female soccer players, ranging from ages 9 to 19. This age range is critical because it captures the period of puberty and growth spurts where the risk of ACL injury skyrockets. The primary goal of the study was scientific and precise. Could real-time biofeedback training reduce the knee abduction moment, that dangerous inward collapse, better than standard training alone? And more specifically, does it matter what body part we tell the athlete to focus on? This is a fascinating nuance. Usually, if a knee is caving in, a coach yells, "Fix your knee." But some biomechanics experts believe the knee is just the victim, and the hip is the culprit. If the hip is weak or lazy, the knee pays the price. So, the researchers wanted to compare two different instructions, telling the brain to control the knee versus telling the brain to control the hip. Let's break down how this study actually worked, because the methodology is like something out of a science fiction movie. Imagine you are one of the young participants in this trial. You walk into a laboratory that looks half like a gym and half like a video game design studio. You are asked to change into athletic wear, and then the researchers spend time attaching small, reflective markers to your body. These markers are placed on specific anatomical landmarks: your feet, ankles, knees, hips, pelvis, and trunk. Surrounding you are high-speed motion capture cameras. These are the same kinds of cameras used to make movies like Avatar or create video game characters. These cameras emit infrared light, which bounces off the markers on your body and goes back to the camera. A computer then takes all that data and creates a digital 3D skeleton of you in real time. When you move, the skeleton on the screen moves. The participants were divided into 3 distinct groups. This is what makes it a randomized controlled trial, the gold standard of science. Group 1 was the hip-focused biofeedback group. Group 2 was the knee-focused biofeedback group. Group 3 was the sham or control group. All 3 groups went through a 6-week training program. They all did the same exercises: squats, jumps, lunges. But the feedback they got was different. When the girls in the biofeedback groups performed a squat or a jump, they looked at a large screen in front of them. On that screen was a rectangular box or a specialized graph representing their movement. For the knee group, the screen showed them data about their knee position. If their knees caved inward, the graph on the screen would turn red or the bar would drop, instantly telling their brain correction needed. They were instructed to keep the bars in the safe zone by controlling their knees. For the hip group, the screen looked similar, but it was actually measuring the force and torque at their hips. They were told to control the graph by using their hip muscles, their glutes. The screen gave them points or visual rewards when they activated their hips correctly to keep the legs stable. Then there was the sham group. This is scientifically brilliant. These girls also did the exercises. They also looked at a screen. They also saw a graph that moved. But the graph wasn't giving them real biofeedback about their form. It was just a randomized or irrelevant signal that made them think they were interacting with the technology, but they weren't actually getting the biomechanical correction. This was crucial to prove that it was the specific feedback that worked, not just the excitement of playing a video game. For 6 weeks, these young athletes trained. It wasn't just physical training, it was neurological training. Think about learning to ride a bike. At first, you have to think about every wobble. Your brain is working overtime. Eventually, it becomes automatic. You don't think, you just ride. That is what the researchers were trying to achieve with the biofeedback. By seeing the screen turn red every time their knee caved in, the athletes' brains began to associate that feeling with error. By seeing the screen turn green when they landed perfectly, their brains released a little dopamine, a reward. Over hundreds of repetitions, the goal was to move this pattern from the conscious brain, where you have to think about it, to the subconscious brain, where it happens automatically. But the true test wasn't in the training sessions. The true test was the final exam. After the 6 weeks were over, and again 6 months later, to see if the skills stuck, the athletes were brought back to the lab for testing. But the researchers didn't just ask them to jump. They had to trick them. You see, if you ask an athlete to jump and land perfectly, they can usually do it because they are thinking about it. But ACL injuries don't happen when you are thinking about your knee. They happen when you are thinking about the ball, the opponent, or the goal. So, the researchers used a test called the Unplanned cutting task. The athlete would stand on a platform. Suddenly, a light would flash, telling them to sprint forward. As they were running, another light would flash at the very last second, pointing left or right. The athlete had to instantly plant their foot and cut in that direction. This mimicked the chaos of a real soccer game. They didn't have time to think, okay, bend the knee, engage the glute. They just had to react. This is the moment of truth. If the biofeedback training had truly rewired their brains, their knees would stay stable even during this chaotic, split-second movement. The scientists were looking at very specific numbers. The most important one was the knee abduction moment. In physics terms, a moment is a turning force. The knee abduction moment is a measurement of how much force is trying to bend the knee inward. A high number means the knee is under massive stress and is buckling in. A low number means the knee is strong, aligned, and safe. They measured this force during the simple, drop vertical jump, jumping off a box, and the chaotic, unplanned cut. They also looked at retention. It's one thing to have good form on the last day of training. It's another thing to keep that good form 6 months later without any extra coaching. This is vital because we can't keep athletes in a lab forever. We need the training to stick for the whole season. Now, we get to the most important part, the results. What did the data actually reveal after analyzing the movement patterns of these 150 young athletes? The findings were nuanced and incredibly revealing about how the human body learns. First, let's look at the drop vertical jump. This is the standard test, jumping off a box and landing on 2 feet. The data showed that all 3 groups improved, whether they got the hip feedback, the knee feedback, or just the standard training, sham. The girls got better at landing safely during this specific task. This makes sense. If you practice jumping off a box for 6 weeks, you are going to get better at jumping off a box. The simple act of practicing, strengthening the legs, and being in a training environment helped reduce the risk factors during this controlled movement. And this is a huge, but the story changed when they looked at the unplanned cutting task. Remember, the cut is a dangerous move. It is the move that tears ligaments. When the researchers analyzed the biomechanics of the cut, the hip-focused biofeedback group stood out. The data showed that the girls who had been trained to focus on their hips were the only ones who demonstrated a statistically significant improvement in their knee mechanics during the chaos of the cutting maneuver. The knee-focused group did not show the same level of transfer. The sham group did not show it. Only the group that learned to control the movement from the top down, using the powerful hip muscles, was able to maintain a safer knee position when they had to react instinctively. Why is this result so profound? It suggests that telling an athlete to watch their knee might not be the best strategy for high-speed sports. The knee is a dumb joint. It just does what the foot and hip tell it to do. By focusing the training on the hip, the powerhouse of the lower body, the researchers managed to instill a movement pattern that was more robust, more resilient, and more applicable to the random nature of sport. Furthermore, the study looked at retention. They followed these girls for 6 months. They found that the improvements in the hip-focused group were durable. The new motor patterns didn't vanish the moment the screen was turned off. The brain had effectively learned the new program. Critically, the study also monitored for actual injuries. During the follow-up period, 0 ACL injuries were reported in the intervention groups. While the sample size was too small to statistically prove injury prevention, you would need thousands of players to prove that. The absence of injuries combined with the improved biomechanics paints a very promising picture. Science requires us to be balanced, so we must also look at the limitations and uncertainties. First, while the biomechanics improved, this study was a surrogate endpoint trial. That means they measured the risk factor, the knee wobbling, not the injury rate itself over a period of 5 or 10 years. We can scientifically infer that better mechanics lead to fewer injuries, but we cannot say it is a guaranteed cure for ACL tears. Second, the technology used here was expensive and complex. Motion capture labs with infrared cameras are not available to every high school soccer team. A big question for the future is how to translate this lab success into a field success. Can we do this with an iPad? Can we do it with wearable sensors? Third, there is the human element. Puberty is a roller coaster. A girl's body changes rapidly between the ages of 12 and 16. Her height, weight, and center of gravity shift. Training that works at age 13 might need to be reinforced at age 15. The study showed retention for 6 months, but we don't know if it lasts for 5 years without a booster session. So, where does this study fit into the larger world of sports science and medicine? It represents a paradigm shift from strength to neurology. For decades, we thought the answer to injury prevention was just making muscles stronger. If the quad is stronger, the knee is safer. This study suggests that strength isn't enough. You can be strong but still move poorly. This research argues that injury prevention is actually a form of motor learning. It is about teaching the nervous system how to coordinate the muscles in a split second. It highlights that the hip is the steering wheel of the leg. If you control the hip, you control the knee. This has implications far beyond soccer. It applies to basketball, volleyball, handball, any sport where female athletes are jumping and cutting. It also opens the door for better rehabilitation. If an athlete does tear their ACL, this kind of biofeedback training could be the key to helping them return to sport safely, ensuring they don't tear it again. The robust trial, which stands for real-time optimized biofeedback utilizing sport techniques, lives up to its name. It provides robust evidence that we can use technology to hack the learning process, helping young bodies learn safer movement strategies that might just save them from the operating room. The journey of a young athlete should be defined by the joy of the game, the thrill of competition, and the lessons of teamwork, not by the silence of an operating room or the long, painful months of rehabilitation. The clinical trial we explored today offers a glimpse into a future where technology and biology work hand in hand. It suggests that by changing the focus, literally shifting our attention from the knee to the hip, and by using real-time data to visualize our movements, we can rewrite the code of how we move. We learned that while general practice helps, specific, targeted biofeedback focusing on the hip structure creates the kind of resilient movement patterns that hold up under pressure. We learned that the brain is just as important as the muscle when it comes to preventing injury. As science advances, we are moving closer to a world where prevention isn't just a warm-up drill, but a personalized, data-driven learning experience. If you found this deep dive into the biomechanics of sports injury interesting, I encourage you to stay curious about the incredible machine that is the human body. Science is constantly evolving, and every study brings us one step closer to keeping our athletes safe, strong, and on the field. Thank you for watching, and here's to a future of safer sports for everyone. Please subscribe to the channel.